am worried and angry about the complacency that I've seen from the Secretary of State towards the NHS. Look, I knew the situation was bad, Mr Deputy Speaker, but when I didn't realise how bad until I visited St George's A&E last week, in the hospital that serves my constituency, and had to declare a critical incident because of the situation in A&E. All the doctors and nurses I spoke to agreed that this was the worst time they've ever experienced in their whole careers. The winter ward was opened last year but had to stay open for the whole year, and so there's now no more space for the extra winter surge. 60 nurses have resigned from that department because of the stress of the workload and underpay. The additional winter payments which came from the government were only paid in December and have to be spent by March, giving them hardly any real impact. It's chaotic, the situation at the moment. They are having to practice corridor care for patients for the first time in the hospital, and they are broken-hearted that they have to do that. They've had to stop elective heart surgery since the beginning of December. Mental health patients are being treated in A&E for 5 days, Mr Deputy Speaker. They need a long-term plan, not being surprised by winter every year. There are 4 areas that they really see as being critical community care shortages: eating disorders, Korsakoff dementia patients, frail patients who have a stroke after a fall, and functional neurological disorder. These are huge gaps in community care, and I'm glad that the Secretary of State is here to hear me raise them as well. They were raised by the staff there. Conservatives are failing the people of Putney, Southfields and Roehampton. The Conservatives are failing the British people. Labour has a plan to fix this, but they don't. Pain, suffering and preventable deaths are up. GP waiting times are up. A&E waiting times are up. Mental health and cancer assessment times are up. There's only one conclusion: the Conservatives' time is up. Yeah.